We all know that that gut-wrenching feeling of loss. And it hits differently, maybe more profoundly, when you've been the main support for someone through a terminal illness.
Oh, absolutely. The grief afterwards is, well, it's a unique kind of journey, often without a clear map.
Yeah, you feel kind of adrift. And that's exactly the territory we're exploring today in our deep dive. We're getting into a master's thesis from Tsuchi University by Yong-sheng.
Right.
And the core idea, sort of boiled down, is about finding comfort in nature specifically, how tending plants might help widowers work through their grief.
It's a really interesting angle, looking at how bringing plants, gardening, into psychological counseling can actually support people who are bereaved.
Yeah.
And what makes it particularly insightful, I think, is that it's grounded in humanistic psychology,
Okay.
which really focuses on the person's own experience, their subjective feeling of suffering. We'll get into that.
So our mission today is really to unpack the main arguments from this thesis. What's the value here? What makes it stand out?
And how does this mix of nature and therapy actually create a path through grief?
Right. And the study uses a phenomenological approach, too, which seems really important for understanding the lived experiences.
Exactly. It's all about trying to grasp what it actually felt like for these individuals going through it, not just ticking boxes.
Okay, so let's dig in. The thesis starts with a really crucial point. Grief after caring for a terminally ill spouse. It's not really a medical condition like, say, pneumonia.
Right. It's profound suffering, absolutely, but not an illness in that typical diagnostic sense.
That's often missed, isn't it? Our healthcare system is mostly set up for diseases.
And bereavement, while incredibly painful, kind of exists outside that framework.
And it strikes me, it's like you've been so deeply involved in the medical system with your loved one,
Yeah.
and then they pass, and suddenly you're outside that whole structure, facing this massive emotional void.
And often feeling like nobody really gets what you're going through. It's a real shock to the system.
A jolt. Yeah.
Exactly. The focus is so intense on the patient, the caregiver can feel a bit invisible. And then afterwards, often left alone with the grief.
The thesis also mentions something called difficult grief, right, when things get stuck.
Yes, when that natural grieving process seems to stall or it's just intensely prolonged, it's not about a timeline, really, but more when the healing just doesn't seem to progress.
I can imagine that. Being trapped in that pain, not finding a way forward, it must be debilitating.
Absolutely. And this is where that humanistic clinical psychology perspective is so helpful.
How so?
Well, it moves beyond just looking for symptoms or a diagnosis.
Okay.
Humanistic psychology, especially the tradition that's developed in Taiwan, with figures like Yu Dehui, it really emphasizes understanding the individual's unique experience.
Their suffering, but also their strengths.
Exactly. Their capacity for growth, for healing. It's a much broader view than just spotting pathology. It's about the whole human condition.
So how does the thesis connect this to therapeutic horticulture? What's the link between plants and this kind of loss?
Well, this is where it gets really fascinating. The idea is to use the plant's life cycle, its growth, its changes, even when it goes dormant, as a kind of mirror.
A mirror to what the bereaved person is feeling inside.
Precisely. Think about it. A seeds, sprouts, grows, blooms. Maybe it wilts a bit, but then maybe new shoots appear. There's a real parallel there with the ups and downs of grief.
It's like
Yeah.
by caring for another life, watching it, you're sort of indirectly facing your own challenges.
Yes. There's this tangible link to the natural world, its rhythms, life continuing even when you faced loss.
I actually remember a time feeling really stuck myself and just having a few herbs on the windowsill. Watching them grow, it felt like, I don't know, a tiny bit of hope, a reminder that life does keep moving somehow.
That's a perfect illustration of the core idea. So the research involved an 8-week program.
Okay.
Each week, caregivers who'd recently lost a spouse after a terminal illness came for a 1-hour session.
And the session combined counseling with actually doing gardening things.
Exactly. It wasn't just talking. It was hands-on, engaging with plants. And then, after the 8 weeks, the researcher did in-depth interviews.
Qualitative interviews, right, to get their perspective.
Yes, crucial for hearing their reflections on the whole experience, the counseling, the gardening, and that data was analyzed using phenomenology.
Okay, so let's get to the findings. What did they discover? How did interacting with plants actually help?
Well, one really significant thing was this sense of a mutual relationship developing.
Between the person and the
Yeah.
plant.
They felt they were actively caring for something, and the plant, by growing, gave back this sense of life, of progress.
That makes sense. It could gently shift the focus away from just dwelling on the grief.
It seemed to, yeah. Offering a positive interaction, something alive in their daily routine, like you said, a small green island.
A green island in a sea of sorrow. I like that.
And another thing was the power of cultural metaphors.
Ah, interesting, like what plants symbolize.
Exactly. In many cultures, especially in Asia, plants represent things like resilience, growth, the cycles of life.
Right.
So just having plants around could subtly trigger these deep-seated ideas, leading to little moments of insight about their own grief journey.
It's like these cultural symbols offer a gentle, familiar language for processing really difficult feelings.
Mm-hmm.
Did it help socially, too?
Yes, that was another key finding. The plants became conversation starters.
Oh, right.
People might share tips or swap cuttings or just ask about each other's plants. It helped maintain social roles and connections.
So the plants acted like little social bridges, helping fight that isolation that often comes with grief.
Mm-hmm. And it also fostered a feeling of being cared for when others showed interest in their plants. Small interactions, but meaningful.
Okay, but it wasn't just the plants, right? The counselor's role must have been vital.
Absolutely crucial. It wasn't just about handing over a pot plant. The counselor provided that safe space to actually talk.
To express all those messy, difficult emotions.
Yes. Grief needs an outlet. Having someone listen without judgment, validating those feelings, that's essential to prevent grief from getting stuck, suppressed.
And that really ties back to the humanistic approach, doesn't it? Empathy, understanding.
Perfectly. So the counseling helped them process the loss, mourn, maybe even start to transform some difficult memories.
And did the counselor help with the gardening part, too?
They did, offering practical tips, skills for planting, kind of experiencing the plant's changes alongside the person. It was emotional and practical support.
A really integrated approach.
And what's quite touching is that the plants often remained as companions, providing that connection even after the formal sessions ended.
Like a lasting reminder, a living presence. Okay, let's just briefly touch on those frameworks again, humanistic and phenomenological. How did the study really live those out?
Well, the humanistic side is clear in its focus on the individual's subjective experience of suffering.
Right, not just seeing grief as a problem to be fixed.
Exactly. It respects their unique journey, their meaning-making, the potential for healing, very much in line with the humanistic tradition, especially how it's developed in Taiwan.
And the phenomenology? Remind us how that fit in.
Phenomenology is about getting to the essence of an experience as it's lived.
Okay.
Trying to understand, say, grief, not by listing symptoms, but by grasping what it feels like from the inside.
So the researcher listened deeply to the participants' own words, their descriptions.
Yes, trying to understand their world without imposing outside theories or simplifying things, really trying to capture the core meaning for them.
Like stepping into their shoes for a moment. Now, you mentioned the researcher, Yong-sheng, had a personal connection here.
Yes, the introduction to the thesis was quite revealing. They actually started out interested in plant sciences and horticulture before moving into clinical psychology.
Oh, wow. So there was a real personal link to the topic from the start.
Seems so. Not just academic curiosity, but maybe a deeper resonance.
And they also had experience in palliative care.
That's right. And that experience seems to have shown them that, well, maybe traditional psychiatric approaches don't always fully meet the needs of people facing loss or their caregivers.
They saw the gaps, perhaps.
Possibly. Saw the limits of a purely medical view when faced with that kind of deep human suffering.
And gardening was personally helpful for the researcher, too.
Yes. They mentioned finding stress relief and solace in gardening themselves, and that personal experience apparently sparked the idea for the research.
That's powerful, when personal insight fuels professional inquiry.
It really is, asking, could this help others too?
Okay, the thesis also dug into the history of horticulture therapy in its literature review.
Yes, it gives great context. Shows this isn't a new idea at all. Goes back centuries, really. Mentions figures like Dr. Gregory, Dr. Benjamin Rush using gardening for mental well-being way back.
And things like World War II pushed it forward.
Definitely. The need for rehabilitation for veterans really helped formalize it as a therapy.
So, solid historical roots. And the review looked at why plants might help, the theories behind it.
Absolutely. Things like Reducing psychophysiological overload, nature being less demanding on our senses, calming us down.
Okay.
Also learned associations, those cultural meanings we talked about, and even evolutionary ideas that maybe we have an innate connection to nature, sometimes called biophilia.
That deep down pull towards the natural world makes sense it would impact us psychologically. And the benefits seem really widespread.
They really are. The literature points to cognitive boosts, better attention, memory, psychological gains like less anxiety, more self-esteem, social connection, even physical benefits like better motor skills.
Wow. And it's used in lots of different settings.
Yeah, hospitals, rehab centers, schools, for conditions like autism, depression, dementia, and of course, grief.
What about the situation in Taiwan specifically?
The thesis touches on that. Horticulture therapy is recognized and growing there, but the medical system still leans heavily towards medication.
So it's seen more as complementary.
Often, yeah. The researcher positions their work within therapeutic horticulture, really highlighting how their clinical psychology skills integrate with the healing power of plants, making a case for a more combined approach.
Advocating for a more holistic view in that context, the review also specifically mentioned the struggles of caregivers, didn't it?
Yes, emphasizing the huge emotional and physical toll, both during the illness and after the death, how their own distress often gets overlooked.
And it referenced standard models of grief.
Like Warden's tasks of mourning, the dual process model. Just providing frameworks for understanding how complex bereavement is.
Yeah.
You know, the back and forth between confronting the loss and adjusting to life without the person.
But it also noted challenges in providing grief support, even in palliative care.
Exactly. Pointing out that even in Taiwan's palliative care settings, systematic grief support faces hurdles, resources, training, sometimes families being hesitant.
Which really highlights why exploring other avenues, like therapeutic horticulture, could be so important to fill those gaps.
Precisely. And there was that point about developing an indigenous Taiwanese clinical psychology, too.
Right, what was that about?
Emphasizing the need to understand suffering within the local Taiwanese culture, acknowledging that Western models of grief might not always fit perfectly.
So tailoring support to the specific cultural context makes sense.
Yeah, this research is kind of a step in that direction, developing culturally sensitive approaches.
Okay, let's talk about the case studies. They give such a personal view. Case A first.
Right. Case A described as really resilient, faced a lot in life, and then lost her partner of 15 years.
And she used to garden.
Yes, she had an interest, but it faded during the 4 years of intense caregiving, understandably.
So for her, this program was like rediscovering something.
Almost, yeah. And introducing these plants, lucky bamboo, Buddha's hand taro, it brought back joy, a sense of growth she connected to her own healing.
She actually said that.
Yeah, there's a quote about watching them grow and feeling her own spirits lift. A very direct, meaningful link for her.
Wow. Like the plants became symbols of hope. And her relationship with the researcher was important too.
Very. She felt truly understood, supported, able to share things without feeling like a burden. Said the researcher's empathy brought her to tears.
It just shows how vital that human connection is in therapy, alongside any activity.
Absolutely. And beyond her feelings, there were practical changes, too.
Like what?
She started taking pleasure in her living space again, making it her own. Started planning for the future, sorting out insurance. Signs of turning back towards her own life.
Reinvesting in herself after focusing solely on her partner. That's huge. Okay, what about case B? Her situation involved multiple losses.
Yes, tragically lost her mother, grandmother, and father in quick succession before her husband passed.
Goodness. And she had a background related to plants, too.
Came from a tea farming family, and later shared an interest in coffee cultivation with her husband. Part of his Sakazaya tribal heritage, actually.
So a different kind of connection to the plant world. How did she cope?
Her main way seemed to be through work and really dedicating herself to continuing her husband's cultural legacy.
Ah, so keeping busy, finding purpose and honoring him.
Exactly. It gave her focus, maybe some distraction. She mentioned the importance of staying busy. For her, continuing his work, even tasks outside her comfort zone, was a powerful way to process the grief.
The plants perhaps being part of that shared history and legacy.
Likely, yeah. A subtle connection woven into that active engagement, but she still felt the loss, even while busy.
Oh yes, the grief was still there, but maybe the intensity lessened over time as she engaged with life and his legacy. Her commitment was clearly immense. It seems like both women found ways to engage with life again, though differently. Case A, through nurturing new growth.
Yeah.
Case B, through continuing a legacy.
Exactly. It really shows there's no single right way to grieve. The study highlights how support needs to be personalized, tuned into someone's history, interests, culture.
So wrapping this up, what's the big takeaway? This research gives us a really valuable look at how something quite simple, connecting with plants, when it happens in a supportive, humanistic therapy setting, can offer real comfort, help navigate that incredibly personal, tough journey of grief after losing a spouse.
Absolutely. It beautifully integrates our understanding of psychology with the healing potential we can find in nature.
And it really drives home that bereavement isn't a disease.
Not at all. It's a deep human experience that needs holistic, sensitive support, maybe incorporating the natural world more thoughtfully.
It definitely makes you think, doesn't it, about the power of nature, of nurturing life in our own healing, especially during tough times like loss or big transitions. Maybe the final thought for you, the listener, is how could we more intentionally bring nature into our lives or the lives of people we care about when they're struggling? Could that make a difference to well-being? Something to ponder from this deep dive.